If you're coming off an abdominal surgery or post C-section or just having a baby and you're having problems with your abdomen, you should be avoiding abdominal exercises. But what should you be doing? And if you have a diastasis recti, if you have a split right here in your abdomen, what should you avoid and what things should you do? That's the focus of this video. Stick around to the end because we're going to talk about some things that's going to speed up that diastasis recti to heal. Men also get this too. So men, we call it an alien baby. So we'll have some guys that come in, they've had a bigger belly for a long period of time. I can poke mine out right here. If you have a big belly like that, most women just have it for 9 months, but the guys will have it for years on end. And then they'll go to get up from the table, they're laying down, they'll go to come up and it looks like an alien baby poking out. So we make fun of it. They really don't have a lot they can do about it because it's been going on for so long. But if you were dealing with a diastasis recti, then we really want to talk about the things we do post having the baby, because postpartum is when we have the best opportunity to heal because it's still fresh. Now, the worst thing that you can do is do abdominal exercises, because when the belly is out like that, if these muscles have split apart and we have relaxin that comes out, so it's opening up those muscles to create space for the baby. Now, my wife had it both of her pregnancies. She had a diastasis recti. So I have experience working with her, but also have experience working with clients at the clinic, showing them exactly what to do to get out of this. The best thing you can do is work on getting rid of the weight slowly. So we do that by actually resting the first 2 weeks. That's really important. That the first 2 weeks, you shouldn't be exercising anyway. Any of your doctors are going to tell you that. In the first 2 weeks, we actually just want to allow our body to heal a little bit. It's very traumatic to have a baby. I've watched it with my wife. I can't go through it, but I'm right there next to her and supporting her. And it's really important that we take that time. You're taking care of the baby. You shouldn't be lifting anything other than the baby. Baby's super tiny at that size, most of them. So we're going to go through a progression of the first 2 weeks, and then weeks 3 through 6, and then weeks 7 through 12. In those first 2 weeks, you're going to be really caring for the baby, doing all the things you need to do around the house and taking it easy, allowing the body to heal. We always want to make sure that we are getting in and out of the bed to the side. So, and then we see this with people with back pain all the time too. They go to get up and they come straight out of the bed like this. So that's going to put a lot of pressure on our abdomen, and mine pokes out right here as well. So I probably need to work on this. So I'm going to roll to the side like this. I drop this hand underneath my thigh, and I'm pushing with my elbow. I'm going to drop my legs off, and then I'll push up with this arm. And so that's kind of like a pendulum, like I'm just rolling up, and it takes stress off my back. When I lay down, I'm doing the same thing, laying down to the side and then rolling back, and then I'm coming back up and pushing down into that elbow. So getting in and out of the bed to the side is really important if you have back pain, but when you have a diastasis recti or an abdominal surgery, we want to limit the amount of contraction that we have in the abs completely. Remember that muscle tissue is a lot like clothes in the way that if we stretch it and we have a tear in the clothes, then we're going to be pulling on that tear. It's not going to be able to go back together. So if you were sewing something up, right, in the middle of sewing up a hole in your shirt and somebody just started tugging on it, that would be a problem. And that's going to happen when we do a muscle contraction or a stretch. So we really, in the first 2 weeks, we just want to leave it alone. When we get into week 3, we should start doing longer walks. So we just want to gradually increase the time that we're walking. We're getting our exercise, but we're also getting a lot of blood flow through the entire body. And when we do that, we want to gradually move up. Think about it as like blocks in your neighborhood. We go 1 block there and back. We're going 2 blocks there and back. On a daily basis, we're increasing it, and you've got to adjust. I know that there's a lot of stuff going on after you've had the baby. If we're bleeding or having any problems with that, then we want to decrease that. That's our body sending that signal that, hey, you're doing too much, because there's a lot of internal things that have happened through this time period. I'm not an expert on that. I'm really focusing on how do we get the body to heal, and we want to get that diastasis recti to go away. We want all of our cuts to cinch up and allow them to heal. We can work on the scar tissue later, and we're going to talk about that when we get in the stages about 6 weeks. After that 6-week mark, then we can start working on the scar a little bit once it's fully clothed. Thinking about scars, a keloid scar grows up, it'll have a bubble. Now, all scars are gonna grow down, so we don't wanna get scars stuck to other pieces of tissue that they're just above. So we'll actually just work on our scar by just rolling it around very gently. And you can increase your pressure, but think about increasing your pressure from week 7 to 12. It's not the most important thing that we do right at that point. The most important thing is that we avoid doing too much with our abdomen. But when we're working on the scar, we just gently increase that pressure. Now, if you're like my wife, she increased her walks significantly in weeks 3 through week 6, so she was very impatient. But I was right there with her, talking to her about getting in and out of the bed to the side and avoiding activating her abs too much, avoiding doing ab exercises, completely crunches or anything like that, or planks. Planks are not a good exercise for you either. We're gonna engage that abdomen, and because it hasn't healed together, it's gonna split apart even more. We measure it here at the clinic as a finger split. So we put our finger right there and see, do we have a 1 finger split or a 2 finger split or a 3 finger split? So once you get over a 2 finger split, it's really hard for it to heal. So we want to keep it going down. So you can measure that right now on yourself, just seeing long ways how far that split is and where it is. Typically it starts splitting right here, and at the belly button, it's where it's the largest, right? Because that was the biggest protrusion right there around the belly button. So we want to allow that to heal back in. As we're in weeks 7 through 12, we can start doing lunges, start doing squats. We can start doing a lot of more movement exercise, dynamic exercises in standing. We need to focus on developing our glutes. So if you do clamshells, you do bridges, those type of exercises, we're not going to overstretch the abdomen. We still want that to lay down. We want to be gentle with it, but we want to develop the glutes. The more that we can develop the glutes and drive through our glutes, the less pressure we're going to have on our abdomen when we're moving around. And then while we're walking, we're getting small contractions with our abdomen, and those small contractions are actually good. We want to have those because we're getting blood flow in there. It's just the big ones that we're trying to avoid. Now, when we get to week 7, we also start doing hip hinging with our clients. So when we come down into a squat right here, I'm reaching back with my butt. And once I get down, when my hip starts to tighten up right here, then I have a reverse action at my abdomen. So my abdomen doesn't want to allow my pelvis to tilt. So when I get back to here, my abs are going to kick on to resist that. That's called a reverse action. That's a really positive thing to do in this stage of healing, because it's not going to stress the abdomen. It's not going to cause you problems. It's only going to have benefit. But remember that we're just gradually increasing this. A lot of us can get really restless during this time period, especially my wife. It was driving her nuts that she couldn't work out hard. But the best thing that we can do is take it slow. That's how you're going to heal, is by taking it slow and taking your time through the first 12 weeks. Now, when you hit 12 weeks, now we can start increasing to more dynamic exercises. Plyometrics slowly gradually go up to doing more intense exercise, lifting weights, but you've got to keep gauging things about internal problems happening. Is your body giving you any signals that you're having problems? A lot of our clients will come in with back pain initially, so working on the glute muscles, taking stress off of their low back is really important. So we're constantly pushing them to develop those glutes so they don't cause problems. But when you get to 12 weeks, as long as everything internal is working really well, you can start ramping up to doing more high intensity exercise routines. The reason that 12 weeks is such a great space is we get 100% healing at 12 weeks. So at the first 2 weeks, we get 50% healing. At 6 weeks, we get 80%. And at 12 weeks, we get 100%. So we should be almost fully healed or fully healed. Now we can do more high intensity stuff. But what you were doing in that at week 3 through 6 and week 7 through 12, that's building you a foundation. And that's why we talk about developing the glutes. We want to develop the glutes to build a foundation, because that's going to protect the rest of our body. Remember that you had relaxin come out, right? So a lot of your joints started to get lax during the time period when you're about to give birth. Now we have to give our body time to get rid of that relaxin, but then also we've got to develop the right muscles so we have stability. Now we have 2 bonuses right here. If you're struggling to get that diastasis to go back in, then we do a chin lift. So I'm going to lay off to the side and then roll back, and I keep my knees bent right here. And the only thing I'm gonna do, I'm put my hand on my belly right here, and I'm just gonna lift my chin up, and I come back down. You can see I'm not lifting my shoulders up. Now I do that because it's that little subtle contraction that's actually good for the diastasis recti to get it to go back in. And I've had friends, some of my wife's friends that have had a fairly large diastasis recti. We had one friend that was 2 years out. She still had a 2-finger split. And I said, hey, just stop doing all the core exercises you're doing. Lay down, do these chin tucks. So get in and out of the bed to the side, do these chin tucks. She went down to a 1-finger split. It wasn't completely gone, but she had to be realistic after 2 years. She didn't have the guidance that you're getting right here in this video of like taking it slow. She was ready to get the weight off. So a little bit impatient, but she was able to get it down to a 1-finger split where she didn't have to have surgery or anything. So it was a really beneficial outcome for what she was doing. And that's how I know the chin lifts work, because I've seen them work. Number 2 is a postpartum corset. Now, one of our friends is a fitness model, and she told me that the main thing that she did, because she looked great 6 months after the pregnancy, she looked fantastic, and she wore a corset for those first 2 weeks, especially. 6 weeks would be really good, but those first 2 weeks, she wore a corset when she went to bed, right? So she would wear it sometimes during the day, and then she wore it when she went to bed. And so that corset is just cinching her abdomen together, and so it's allowing it to heal. So just like how we talk about loosening up our pant leg, loosening up our shirt, we want to loosen up above and below and let it cinch down together. It's the same thing with that corset. We're cinching it together and we're giving it time to heal. And that's why it's really important when you're sleeping. You shouldn't lose blood flow. If anything's starting to go numb or anything, you've got it too tight. So be gentle with yourself. But those first 2 weeks, just giving it a little bit of pressure so it stays in together, then that's going to allow you the time to heal in your abdomen and get rid of that diastasis recti. Make sure you subscribe to the channel. Check out our videos on glute development. Everything around back pain is also beneficial for any abdominal surgery, because we're avoiding the abdomen in the beginning. Omit anything on the abdomen. See you in the next video. Get mobile and stay active.